This was a MRI for a different indication, and we were just following up. And in the corner, sorry, of the image, we noticed that there was a mass here in the groin. And you can see that it's pretty intermediate signal on T2, and there's flow voids from the artery next to it. And so, and I'll show you, and there's kind of slow flow in the vein above it. And I'll show you post-contrast. So post-contrast, it was pretty avidly enhancing here. And it seemed to be either contiguous with the femoral vein or arising from it, or smushing it. So any thoughts? It's intermediate T2, it's pretty avidly enhancing.
I worry about vascular lesions, but it didn't really show a lot of flow voids on the earlier imaging. It looked a little bit more solid looking, so that appearance is gonna, like a slow flow mass might overlap something that's actually solid and avidly enhancing. So it's hard. I mean, I would worry about a sarcoma, but then again, I want to know if it's a vascular lesion, and sometimes with MRI, you could be fooled.
Yeah, so the few things that we considered, one was a nerve sheath tumor, because, you know, it was kind of oblong looking, and I'll show you the coronal as well.
We do see those a lot around the spine, not as much in the groin, but a neural tumor can look fusiform like that.
Yeah, so we thought about a nerve sheath tumor. We also did briefly contemplate, like, make sure that this is not a varix, like a large varix, given how avidly it was enhancing. But like you were saying, the flow void did not look like just a big, you know, dilation of the vein. And then here we can see that there's actually slow flow of the vein. So I was pretty convinced that it was actually coming from the vein. So we thought it could be a leiomyosaroma, and we did biopsy it, and it came back as a femoral vein leiomyosaroma. Wow. And it was just an incidental finding, yeah, on this lady who had like a completely different tumor, and we were just kind of doing follow-up. So a couple of the teaching points is that, you know, if you see something that looks contiguous with a vascular structure, especially, for example, the IVC, portal vein, SMV, gonadal vein, or even the femoral vein, think about a leiomyosarcoma. We biopsied it like directly down through here, so we avoided these vessels and just took a bunch of core biopsies. And then I just have a couple of PowerPoint slides about it. So, oops.
I tend to include sarcoma in my differential for almost anything that's solid that doesn't have an organ of origin. You just have to put mesenchymal tumors on your list, whether it's benign or malignant, and they get more and more malignant as the person ages. But I got fooled on one when a kid before. There was like a rhabdo in a kid's foot that I thought, oh, it's probably just something benign. I was wrong.
Yeah, so I've been fooled, especially when they're near the IVC or kind of arising from the wall of the IVC. I've been fooled into thinking it's like a sarcoma next to the IVC. But if it's really affiliated with the vessel and it's kind of oblong, think about a leiomyosarcoma. So 62% will be extraluminal. So they arise from the smooth muscle of the wall of the vein, and they can even grow out like extraluminally. So it can almost look like it's just pushing on the vein, but it's actually arising from the wall of the vein. 33% will be extra and intraluminal, and only 5% will be completely intraluminal. So this one was probably a combination, but we couldn't see any of the lumen really. 75% of these will be in women in the 5th to 6th decade, suggesting that there's a hormonal component to their proliferation, just like with fibroids. They tend to be slow growing, well-defined, and have avid enhancement, and they spread along the least resistant tissue planes, so they tend to not really actually invade adjacent structures, but will grow in this kind of oblong fashion along the plane. They have a higher rate of recurrence, and if later stage, then they can metastasize to the lungs, lymph nodes, and liver. So any sarcoma, usually they'll get a chest CT to make sure that they don't have lung mets. Any questions?